Casper's number one for New Country, My Country 95.5. I am Doc. Prairie Wife also with me, and so thankful via the phone from Italy. Former Casper resident Nurse Kelly Seitz. How are you?
I'm good. Thank you so much.
Well, we so appreciate you taking time to visit with us, Kelly. First of all, before we talk about some of the specific things that you're dealing with there in Italy, how recently were you in Casper?
Well, my mom and sister still live there, so I'm back all the time. But I moved away. Shout out to class of 1984 and CHS. But I was just there last summer.
Awesome. Well, as a nurse, what inspired you to work with Samaritan's Purse?
Yes, I've been working with Samaritan's Purse for 10 years, since 2010, the Haiti earthquake was my first deployment. I've been a nurse for 23 years. I was working at my local hospital. I live now with my husband and family in Lansing, Michigan. But I was working at the hospital there and just kind of asked God if there was anything else he wanted me to do with my nursing career, that I was wide open to that. And then the Haiti earthquake struck, and I found a Christian organization, which is Samaritan's Purse, and began working there with them. And then that really evolved into where I am now, 19 deployments and 10 years later.
That's amazing. So when did you actually arrive in Italy?
We arrived on March 17th, and in about 56 hours put up our emergency field hospital, converted to a respiratory care unit. So we've been here accepting patients for about 8 days now.
What is your specific mission there in Italy on that deployment?
Yeah, great question. We are here supporting the local hospital in the part of northern Italy where we are. It's a 600-bed hospital that we're supporting, and it's completely converted into COVID patients. They have about 500 COVID patients, and 100 of those 500 are medical staff from the hospital who have gotten sick from COVID. So they're at capacity, they're overwhelmed, and we're just here to support them and put up our field hospital and help them with ventilator patients. We're a 68-bed hospital.
Gotcha. Nurse Kelly Seitz with us from Italy. Kelly, one of the most staggering visuals that I think a lot of people have seen during this crisis was the lineup of Italian army trucks transporting coffins due to overcrowding at one of the crematoriums there. And I think a lot of us wonder if that's really what you're seeing, if you're seeing that kind of desperation in real life on the ground there.
Well, we're pretty isolated and focused on our mission here, so we haven't seen that component of it, but I wouldn't doubt that that's the case. That hospital is doing an amazing job with what they're faced with, and we're just so proud of them, and we're so honored to work alongside them. It's really surreal because everyone, including us, needs to wear a mask at all times, and when we walk over to that hospital, just all the staff are literally working on adrenaline. They've been in the trenches for an entire month working around the clock. Many of their colleagues have gotten sick, so now they're short-staffed. It's just an incredible situation. It's very surreal for them, and we're just so blessed to be here to help them.
Yeah, Kelly, I saw that reminds me, I saw something that said that upwards of 6,000 health professionals in Italy have been infected, and 37 doctors have actually lost their lives. How concerning is that for nurses like you that are on the front lines of this battle?
Yeah, it's a great question. We have a couple medical staff here in our personal unit, actually, from that hospital. So we know what we're up against. Samaritan's Purse has done a lot of infectious disease in the past. I've personally, been associated with 4 Ebola outbreaks and cholera and diphtheria. So we understand what we're up against, but we're well trained. We have a healthy fear. We understand what we're dealing with, but yet we don't let that stop us from providing compassionate care in the name of Jesus.
Yeah, that's amazing work you guys do. We have Kelly Seitz, Casper native, with us from Italy. Kelly, the U.S. Surgeon General, I think last time I heard their estimations, they said we're somewhere around 2 weeks behind Italy in this pandemic. So if that's accurate, what would be your expectations as far as what we're going to see here if we have the same kind of curve?
Yeah, our staff is so concerned for the states. We see that happening. Our hearts are with our families and our communities. We just want everyone, especially in Casper, I know everyone's afraid and nervous. I want to challenge people in Casper to turn their anxieties, their worries, and their fears actually into action, and don't let it paralyze you. Follow the recommendations. It's really a public health strategy. It's very important to follow the rules that they're putting out there. It's not just a hype situation. It's a strategy to help curtail this virus. So don't be afraid. Knowledge is power. Understand what you're facing, understand the symptoms, find out what you need to do in your community, And while you're waiting in isolation or seclusion, find a way to make somebody else, put them in a better place. If you can shop for groceries for an elderly person to protect them, then find ways to be in action and not just be paralyzed by the situation.
Yeah, I think paralyzed by the situation. I think that's the frustration of a lot of people. But I think there was some concern about the necessity of a lockdown. From what I've seen in Italy, what Italy has actually endured really kind of hammers home the fact that people here really do need to social distance and try to stop the spread of this virus. Right?
It's not just hype; it's a fact. And it's the one thing that will change the tide of this. It's a serious thing, and people need to understand this is so important. I'm so passionate about this message. We here are seeing the fallout of the vulnerable population having to deteriorate and then get put on a ventilator and then be on that for a long period of time and possibly not come off.
Are you seeing this affect any specific demographics, or is it pretty much everybody?
Well, we've had a lot of demographics. It does target the vulnerable population, which is compromised health, other health concerns like people with cancer and the elderly. It tends to hit them hard because they just don't have the reserve that younger people have. Their bodies can't fight it as well. So we need to take that seriously and protect them. They're counting on us to do what's right. That said, there are cases of young people, 18, 25, 30s, 40s, 50s, deteriorating. So you never know which one of us is going to be the one that gets hit. You have to take it seriously. Yeah,
Kelly Seitz, the Casper native, who's helping Samaritan's Purse in Italy on a deployment there, fighting the coronavirus and assisting the patients and supporting the hospitals. Anything in particular you would like to say to your friends and family back here in Casper, Kelly?
Yeah, I would just ask Casper to rise up and be in prayer for us, for Italy, for yourselves. Lean on God. Put on the full armor of God every day. Don't be paralyzed by fear. Trust Him. Do the things that you need to do. Be supportive and encouraging. This is an unprecedented time for literally the world. And talk to your kids about what's going on because they're afraid and they're watching you and to see how you're reacting. Pull away a little bit from the media because it's an onslaught 24/7 of constantly watching it. It just produces anxiety and fear. So just support each other, Casper. Take care of each other. Check in with each other. See if people need things. Again, turn it into action and find something you can do to help.
Kelly Seitz from Italy, please know that from all of us here, we so appreciate your courage and your faith, and our thoughts and prayers will be with you always as you move forward with this.
Thank you so much. God bless Casper.